So hello, Sir Carl here. Today we're gonna discuss about gram-positive cocci. So these are your bacteria that are circular in shape. So for gram-positive cocci in general class, you have three medical importance, genus or three genera rather of cocci, which has medical importance or pathogenic to human. You have their genus Staphylococcus, genus Streptococcus, and your genus Neisseria. So for today's topic, we're gonna discuss about the two cocci, which have positive gram-positive reaction to your gram staining. So you have their genus Staphylococcus and your genus Streptococcus. For your genus Neisseria, this will be discussed by another preceptor. So since these two class are gram positive, so meaning they take up their primary stain, which is your crystal violet. So the color expected is purple or blue. Okay, because of the primary stain crystal violet. So first thing to do in order to differentiate the two, or in general the coccus, you need to perform gram staining. Again, gram staining is a key diagnostic tool in microlaboratory. So this is the first thing to do in order to differentiate or to give you presumptive identification of the organism. Okay, so gram staining, if you still remember, the principle behind is based on cell wall differences. Okay, so for gram-positive organism, remember they have thicker peptidoglycan layers, so they take up more stain compared to your gram-negative. While your gram-negative, remember, it still contain lipopolysaccharide or your outer membrane portion, in which that outer membrane portion, when you do stain for your crystal violet, it will absorb, but when you do decolorizer, that outer membrane portion will be washed out, therefore leaving the organism to be colorless. So once the organism has been exposed to the secondary stain, which is your safranin, it will take up the color pink or red. That's why your gram negative is pink or red, while your gram positive will still remain purple because it has thicker peptidoglycan layer, and because of the cross link of your teichoic acid, remember, and the presence of other acids, it will help bind the crystal violet and your iodine complex class formation. It will make the peptidoglycan more porous para hindi makalabas yung stain. Okay? So, for gram positive, you have the family Micrococcaceae. Under which you have your family Streptococcus and Staphylococcus. For gram negative, you have their family Neisseria. Okay, so we'll focus more class on the gram positive cocci. Okay, so in order to differentiate Staphylococcus and Streptococcus and your Micrococcus, we need to perform next catalase test. So catalase test, I'll be discussing that one on the next slide. For catalase positive reaction, you have their family Micrococcaceae and Staphylococcus, while your Streptococcus class are negative for catalase test. In order to differentiate the two, Micrococcus and Staphylococcus, Micrococcus often resembles class as Staphylococcus, but Micrococcus is, remember, these are form regular pockets of 4 or tetrads, while your Staphylococcus are groups in clusters. Okay, so next thing you need to do in order to differentiate the two, you will perform glucose degradation or oxidation fermentation test, in which oxidase positive or oxidation reaction positive is your Micrococcus, while your fermentation positive is your Staphylococcus. So glucose degradation test class or oxidative fermentive test is used to determine class bacteria. If the bacteria metabolize carbohydrate oxidatively by fermentation or non-saccharolytic and therefore have no ability class to use carbohydrates in the media. Discussed about catalase test. Okay, so catalase test is used class to detect the presence of cytochrome oxidase enzyme. So the main purpose of catalase test class, after you will employ this test class after doing gram staining. So this differentiate the members of the family Micrococciae from Streptococcus, or from differentiate Staphylococcus from Streptococcus. Remember, your Staph class is catalase positive while your Streptococcus is catalase negative. So the principle behind is because the main reagent here is hydrogen peroxide or your agua oxinada, you add this to the small amount of bacterial growth. So the procedure class, you add a drop of 3% H2O2 solution. You place that one on a sterile glass slide and you add a small amount of bacterial growth class from your culture medium. If the reaction is bubbling or effervescence, then that is positive because of the release of oxygen. And if the reaction is just a normal suspension without bubbles at all or effervescence, then that is negative. So that's therefore that would be Streptococcus. But if the reaction is bubbling or effervescence, class positive for effervescence, you think of Micrococcus or Staphylococcus. So, since you already have the idea that it's Micrococcus or Staphylococcus, then you need perform oxidative fermentative tests or glucose degradation testing. Again, micrococci are either oxidative or inert or saccharolytic. Okay, while your Staphylococcus are fermentative. So they ferment glucose. Okay, so as I said, class, your Staphylococcus species and your Micrococcus species are distinguishable from the related family Streptococci. So by doing catalase test, this shows how catalase positive and gram positive can be differentiated. There are also other organisms class that show pseudo-catalase reaction, and this includes your Aerococcus and your Enterococcus there. Okay, so the table here, class, shows you the differentiation among gram-positive, catalase-positive cocci. So things to remember here are the reaction of your Staphylococcus, the reaction of your Micrococcus. So aside from doing OF tests, we also perform in the laboratory modified oxidase tests or using your microdase disc. So these are available commercially. So the test is usually used class for differentiating Micrococcus from Staphylococcus. So in doing this, you will need an amount of growth from a 24-hour-old rather culture, which is smeared onto the disc known as your microdase disc. So Micrococcus class turns blue within 2 minutes while your Staphylococcus is negative. So again, positive reaction for this one is color blue. Okay, so microdase disc. Also, take note of the antibiotics, bacitracin, furacilidone, and lyostaphin. So, for these three antibiotics class, Kirby Bauer or microdilutions are being used. So, usually, in the laboratory, we test differentiate Staphylococcus and Micrococcus using bacitracin antibiotics. So, Staphylococcus is resistant while your Micrococcus is sensitive. So, again, familiarize the reaction on the table. So now let's discuss Staphylococcus since this is more pathogenic compared to your Micrococcus. Micrococcus, by the way, class is just some normal flora because these are also found in on our skin, and it can cause diseases once it enters the skin or some for immunocompromised patients. So Staphylococcus class is a gram-positive cocci and spherical in shape. The name Staphylococcus is from a Greek word staphyle, which means bunch of grapes, since they are arranged in clusters when viewed under the microscopes, but are also seen in single, pairs, tetrads, and chains. They are clusters class because during binary fission or binary reproduction class, they are divided into horizontal and vertical, forming large clusters. Okay? So generally, all Staphylococcus are catalase positive. They grow best on aerobic conditions but behave as facultative anaerobes. So again, facultative anaerobes, with or without the presence of oxygen, they will grow. So your Staphylococcus are non-motile and non-performing. This is the gram stain of your Staphylococcus. While this one, the last here, this is an electron micrograph of your Staphylococcus. So if you notice, if you do compare class, you will really see large um, spherical shape or cocci. Okay, and Staphylococcus class stains darker compared to your Streptococcus. So, for genus Staphylococcus, you have different species that are medically important. You have their Staphylococcus aureus, Staphylococcus epidermidis, Staphylococcus saprophyticus, Staphylococcus hemolyticus, and Staphylococcus lugdunensis. So, among the five species class, you have their Staphylococcus aureus considered as the most pathogenic among the five species. Okay, so the source of infection class of Staphylococcus is is from shedding of human lesions, because again, Staphylococcus class are normal flora of the skin. So you can also found Staphylococcus on fomites. So when we say fomites, these are inanimated objects. So these are the non-living things, such as medical devices. Okay, ano pa? Yung mga usually makikita natin sa hospital settings class, those are probably contaminated with staph. So that's why before any surgical procedures, those medical devices as well as instruments class are disinfected or sterilized. You also have contaminated lesions, especially from respiratory tract and skin, and asymptomatic carriers among hospital staff and patients. So this is common class source of infection, because many of us are not aware that we are carriers of Staphylococcus aureus, particularly MRSA. So what is MRSA? That's your methicillin resistant Staphylococcus aureus. So that is why class nurses assigned in nursery units, especially in ICU isolation of nursery, they are screened class. Okay, I think quarterly with MRSA. So they are swabbed on their nasal cavities as well as groin area and axilla area for the presence of MRSA. So this is to avoid class infections that will be passed to the baby, because it can cause serious diseases. So what is the mode of transmission for staph? Staphylococcus infection can be spread through endogenous strain to normal sterile site by a traumatic induction like surgical or microabrasions, or as a result of implantation of medical devices like shunts and prosthetic devices. As I said, Staphylococcus is common sa skin. So they can cause diseases class once they get inside to the body. Okay, particularly to the sterile site of the body parts or the body in general. So you can also acquire or transmit Staphylococcus infection by a person-to-person transmission or by fomites or even air class. And they can also transmit from infected skin lesions, so especially for patients or person who have skin lesions like cellulitis, impetigo, boils, even boils class, or um, in our dialect we call it matagtiki. So you can transfer that to another person as well, because matagtiki or boils class is a staphylococcus or staphylococcal infection. So let's go to Staphylococcus aureus. Okay, so Staphylococcus aureus, as I said, is the most virulent species of Staphylococci. These are species is responsible for 80% of the suppurative infection in human, and it has the capacity to produce diseases, not to diminish even with the introduction of antibiotics. Because again, there are certain strains like your MRSA or even your vancomycin resistant staph, okay, that are resistant to antibiotics, and these are not killed by ordinary antibiotics. Your Staphylococcus aureus as well is an important pathogen for hospital and acquired infection. And dominant size of your Staphylococcus aureus class is your anterior nares, axilla, perineum, and even our skin. Okay, so these are the areas where you can um, culture or you can get Staphylococcus aureus. Okay, if you notice class, these areas are usually moist because Staphylococcus aureus class in general loves to live in a moist area. So the principal virulence factor is your coagulase enzyme. So 97% of Staphylococcus species has coagulase or positive for coagulase. So for morphology, Staphylococcus aureus class again is a gram-positive cocci clusters or grape-like. Again, these are non-motile and non-spore forming. Even these are also non-capsulated, but there are also strains class that are capsulated for Staphylococcus aureus. Okay, there are studies that they found out that some strain of Staph aureus had capsules, which also aid them to mask as antigen. So your Staphylococcus aureus class produce lipochrome. That is why you have a golden yellow pigment on a blood agar plate, and usually class Staphylococcus aureus are beta hemolytic. Okay. Um, if ever class the Staphylococcus aureus is non-hemolytic, meaning gamma hemolysis, it possesses gamma hemolysis, usually these are not the virulent one. But if ever the Staphylococcus is beta hemolytic and has golden yellow colonies, probably these are the most virulent strain of Staphylococcus aureus. And usually, you will see this with MRSA strains. Now let's go to the antigenic structures. Let's discuss virulence factors. Staphylococcus aureus or Staphylococcus in general, you have antigenic structures that will aid them to cause infection. Okay, so let's discuss first the major components of their cell wall structure. So you have their peptidoglycan layer, peptidoglycan. So peptidoglycan class is a polysaccharide polymer which provides a rigid exoskeleton of the cell wall, okay, which constitute 40 to 60% of the cell weight. So the peptidoglycan layer class of the Staphylococcus has the same effect with the outer membrane. Remember your outer membrane, which is endotoxin. It has the same effect with the endotoxin class. Okay, its function is to elicit production of interleukin 1 and opsonic antibodies by monocyte. Once interleukin 1 is an endogenous pyrogen class which can cause fever. Okay, so opsonic antibodies, meaning it inhibits opsonization that might probably kill the microorganism. So your peptidoglycan layer can be a chemoattractant and have endotoxin like, as I said, activity, and it also activates complement system. So your peptidoglycan class is composed of acetylglucosamine and acetylmuramic acid, diba? Those are the linkages that forms your peptidoglycan layer. For chemoattractant, it attracts class polymorphonuclear cells, okay, causing inflammations on that particular area, localized inflammations. You also have their teichoic acid. So teichoic acid is a polymer of glycerol phosphate or ribitol phosphate. Glycerol phosphate is present with Staphylococcus epidermidis and ribitol phosphate is present with Staphylococcus aureus. So the function of your teichoic acids plays important role in maintenance of normal physiologic function of the cell, and it regulates cationic environment of the cell. So anti-teichoic acid antibodies are detectable by gel diffusion. Teichoic acid or your anti-teichoic acid antibodies class in general are found usually in patients with active endocarditis due to Staphylococcus aureus. The last structure class is your protein A. So your protein A is a bacterial surface protein that has been characterized among a group of adhesin called MS crumbs. So what is MS crumbs? Your microbial surface components recognizing adhesive matrix molecules. So this is the major component of the cell wall of your Staphylococcus, or in general, Staphylococcus. Okay? So it is also the major antigenic determinant unique to Staphylococcus aureus. Protein A class is antiphagocytic because it binds through the Fc portion of your immunoglobulin G, except class for the IgG3. Okay, diba? You have 4 IgGs. So, except for IgG3 class, your protein A will bind to the Fc portion of those immunoglobulin. So now let's go to pathogenicity. So pathogenicity class in general enables the organism to cause local or systemic infection. So what are the factors or the enzymes or the proteins that cause that aids rather your Staphylococcus aureus or your Staphylococcus organism to cause? So you have there the surface proteins, your protein receptors. So your protein receptors adhere to tissue surfaces so they can colonize and multiply. You also have polysaccharide capsule. Again, the main function of your capsule, it protects the organisms from phagocytosis. So similar, it protects organisms from complement-mediated attack of polymorphonuclear cells, macrophages, and other cells because these are phagocytic cells. So it prevents phagocytosis. You also have extracellular enzyme as your virulence factor. As I said, the main principal virulence factor of staph is your coagulase. So coagulase is 97% of Staphylococcus aureus isolated in human produce this type of enzyme. So this enzyme class reacts with your blood factor in plasma to initiate clot formation. So that is why class your Staphylococcus, in order to differentiate the species of staph, you will also need to perform coagulase tests. So I'll be discussing coagulase tests later. So your coagulase also enhance the disposition of the fibrin around the organisms to protect them from phagocytosis. So take note, coagulase is the main principal virulence factor of your Staphylococcus aureus. Okay, so another extracellular enzyme class is your lipase or your spot splitting enzyme. This is produced class by your coagulase positive and coagulase negative staphylococci. These are essential class for bacterial survival of your organism in the sebaceous area of the body. So these help class the colonization of the organism in the oily skin surfaces. So it is important class in the formation of furuncles, carbuncles, and sometimes boils. So because this enzyme class counteracts the fatty substances secreted in the body. The next enzyme is your hyaluronidase or your spreading factor. Remember, class, hyaluronic acid in general are found in intracellular ground substances of the connective tissue. Your hyaluronic acid class parang serve as a glue or that connects between each connective tissue. Okay? So, your Staphylococcus class an ability to digest that glue substance that binds the connective tissue, causing spread of bacteria going to the deeper portion of the body. So, or deeper portion of the skin, rather. So, instead na napasa sa superficial class, your Staphylococcus aureus has the ability to digest the barrier, diba? Your connective tissues are connected together parang to give us protection to the deeper tissues or to the deeper portion of the skin, but your Staphylococcus aureus class can break that barrier, that hyaluronic acid, causing them to spread deeper portion of the skin. You also have staphylokinase. Staphylokinase is a proteolytic enzyme with fibrinolytic activity. So staphylokinase class, the main function is to desolute the clot in order to spread infection further. These are produced by most strain of your Staphylococcus organism. Staphylokinase is also known as fibrinolysin. It causes fibrinolytic activity class. Generally, the main function of your staphylokinase class causes fibrinolytic activities by dissolving fibrin clots. So, the main function, fibrin clot degradation or fibrin clot dissolution. You also have nuclease or denase. These are heat resistance proteins. So, this degrades nucleic acid DNA. This is most specific for Staphylococcus aureus in general, and it's found in the cell surface of 90 to 96% of your Staphylococcus. So, your denase class, the main function is to lower the viscosity class of the exudates, giving the pathogen to more motility. Okay? So, you also have hemolysin or your cytotoxin. So, your hemolysin, in general, lyse RBC by destroying their membrane. So, once their membrane is destroyed, it produces tissue damage or even abscess formation. So you have 4 types of hemolysin. You have alpha hemolysin, your beta hemolysin, your delta hemolysin, and your gamma hemolysin. And these are chromosomal mediated class hemolysins. Again, hemolysin is also known as cytotoxins. So, main functions class of hemolysin or main effects rather of hemolysin, it causes anemia and make iron class available for the growth of the organism. So because it destroys RBCs, so the irons are released class, causing the patient to be anemic, obviously, and that iron class will be utilized by the organisms for their growth. Cause the 4 types, no? Your alpha hemolysin class is the most powerful hemolysin that lyses RBCs of various animals, including your platelets and your macrophages. So, this leads to tissue damage. This is the predominant hemolysin produced by Staphylococcus aureus. So, generally, class, your alpha hemolysin disrupts smooth muscles in blood vessels, and these are toxic, okay, to RBCs and even to hepatocytes and platelets. So your beta hemolysin or your beta toxin, this degrades the sphingomyelin and therefore toxic to many kinds including red blood cells. So Your beta toxin class believed to work in conjunction with your alpha toxin, and these are heat labile toxins. So it catalyzes the hydrolysis of membrane phospholipids, resulting to cell lysis. Your delta toxin disrupts biologic membranes and may have the role in Staphylococcus diarrheal diseases. Okay? So your delta toxin class is cytolytic to erythrocytes and demonstrate non-specific membrane toxicity among other mammalian cells. While your gamma toxin class is produced by all strains of Staphylococcus aureus and may actually function in associate with your PBL or your Phantom Valentin leukocidin. So, your gamma toxin class is a leukocidin. So, from the word leuko, meaning it WBCs. So, it lyses white blood cell. Okay, and it goes with your Phantom Valentin leukocidin proteins. Valentin leukocidin. So these are composed of two protein components that kills white blood cells of human and incapacitate phagocytic line of defense of the host. So your PBL class responsible for the various skin, wound, and deep tissue infection, which is common class sa Staphylococcus aureus. And many of these class organism, many of these infection starts with, for example, skin infection lang, no? And once if the organism class produce Valentin leukocidin class, it may be life-threatening, okay? Because if not treated earlier, it can cause pore formation in the cellular membranes, leading to necrosis and severe inflammation. So your Phantom Valentin leukocidin or your PVL class is an important virulence factor of your CA MRSA infection. So again, your PVL class is also toxic to white blood cells. Since they are toxic to white blood cells, the white blood cells are prevented class from the clearance of organisms by the immune system. So your PVL is encoded on a mobile phage. So still chromosomal mediated type of enzyme. You also have enterotoxin. Your enterotoxins, these are heat stable, resistant to the action of the GUT enzyme. These are produced when Staphylococcus aureus grow in carbohydrates and proteins and foods. So these are most excreted from the cell, but some accumulate inside the cell or either injected directly are released by cell lysis. So your enterotoxin class is the main responsible why you have food poisoning caused by staph. Okay? So your staph class produce this toxin causing food poisoning, okay, or gastroenteritis. We have different types of enterotoxin. So you have their A, B, C, D, E, G, J, K, R, U, and V. The type A and D is the most frequent associated with Staphylococcus food poisoning. Okay, while your type B, these are associated with hospital-acquired infection, and with the ingestion of 25 microgram results to vomiting and diarrhea, causing pseudomembranous enterocolitis. Pseudomembranous enterocolitis class is also present for Clostridium difficile infection. Your enterotoxin F is recently recognized toxin which is associated with toxic shock syndrome. Toxic shock syndrome is another disease, and this is not associated with food poisoning. Exfoliative toxin. So exfoliative toxin, obviously, it talks about skin. So it causes skin infection. So these toxins are associated with skin infections. So you have two types of exfoliative toxin. You have your exfoliative toxin A and exfoliative toxin B. Okay, so your exfoliative toxin A are heat stable, while your exfoliative toxin B are plasmid mediated and heat labile. So exfoliative toxin class in general, these are epidermolytic toxin of Staphylococcus aureus, yield the general desquamation of staphylococcal scalded skin syndrome. So this is the main toxin responsible for scalded skin syndrome. Scalded skin syndrome is usually seen sa mga babies class, okay? Causing mga slowing off of the skin to the babies. That is why, as I said earlier, it is very important for the nurses, especially assigned in ICU, sa NICU unit, nursery ICU unit, to be screened with Staphylococcus, particularly MRSA, because it can pass infection, it can pass organism to the babies, causing skin diseases. So your exfoliative toxin class in general helps dissolves the mucopolysaccharide matrix of the epidermis. So once this mucopolysaccharide matrix of epidermis is destroyed, it will now affect the function of your epidermis. So all of the immune cells will come contact, causing inflammation and even necrosis. So exfoliative toxin class is responsible for exfoliative dermatitis, your bullous impetigo, and even your staphylococcal scarlet fever, which is common in the babies. Okay, so another toxin released by Staphylococcus aureus class is your toxic shock syndrome toxin 1 or your TSST1. So this is the same as your enterotoxin F. As I said a while ago, your enterotoxin F is not associated with food poisoning but rather with toxic shock syndrome disease. So toxic shock syndrome toxin 1 or TSST1 class is a super antigen. When we say super antigen, this is different from the normal antigen, because on the normal process of antigen, if you still remember your adaptive immune response discussion, once the body recognize the pathogenic microorganism, it will elicit immune response specific to that particular organism. So it will bind. This is your dendrocytes or your antigen presenting cell, passing the antigen to your MHC class 2 or your toll-like receptor, and this is your T cell class. Your T cell has this receptor as well, so they bind together and give specific immune response. So that specific immune response now signal neutrophils or any cells, okay, to kill that particular organism. So what happened with super antigen? Super antigen class bypass the process. So in the microorganisms class are not being recognized by your antigen presenting cell. Instead, the toxin or the antigen class bind, the super antigen bind laterally to the T cell groove and your MHC class 2, yielding to T cell stimulation, and that T cell stimulation class is unregulated or not specific. So if this happens class, a lot of T cell class are being activated in the body. Okay, once there is activation of T cell class or unregulated activation of T cells, there will be chaos. Okay, so because there will be chaos class, because cytokines, remember, diba, once there is a binding of your MHC and your T cell, it will release cytokines and chemokines, and these are being regulated class. But imagine if this bypass, wala siya na-recognize ni cell, so ni automatic lang siya bind dira, it causes signals to all T cells. Approximately class in study, in some journals, approximately 25% of the T cells class are being activated by a single super antigen. So it will cause chaos, therefore giving more neutrophils, more cytotoxic T cells, and this, if ever, diba, more of these phagocytic cells will lead to huge inflammations. So your toxic shock syndrome toxin class is associated with fever, shock, multi-system involvement, including desquamative skin rash. So these are the signs and symptoms of toxic shock syndrome disease. So as I said kanina, this is your T cell activation, this is your antigen presenting cell, this is your T cell there is one super antigen here. Since it bypassed the normal process class, all T cells are being activated. Then once all T cells are being activated, so it will release more chemokines. Their dendritic cells will release more chemokines. Your monocytes will release more chemokines, causing now huge inflammation. So what are these chemokines? Like your interleukin 1, interleukin 6, tissue necrosis factors, which causes now fever, even hypotension, and septic shock as a result. So now let's go to diseases. Okay, diseases caused by your Staphylococcus aureus. So you have their food poisoning, toxic shock syndrome, scalded skin syndrome, skin infection, and even acute bacterial endocarditis. With food poisoning. Your food poisoning again is due to the preformed enterotoxin. Your food poisoning class Staphylococcus aureus is not again caused by the organism, but rather it's the toxin released by your organism. Okay? Again the food poisoning caused by Staphylococcus aureus is not caused by the organism itself. It is caused by the toxin released by the organism. So, if ever class the patient experience, okay, food poisoning caused by Staphylococcus aureus, obviously you cannot culture the causative agent because it is only the toxin, okay, released by the organism. It's not the organism itself present on that particular diseases. Okay, so these are food poisoning caused by staph are associated with food rich in carbohydrates like pastries, ham, chicken salads, processed meats, custards, and others. The incubation period class for food poisoning caused by staph is 2 to 6 hours, followed by signs and symptoms like abdominal cramps, nausea, vomiting, and diarrhea. And what's good for staphylococcal food poisoning, these are just self-limiting. So, rapid recovery takes place within the 24 hours. So, if ever class you experience staphylococcal food poisoning, no need to take any antibiotics or any antimicrobial drugs. Just release all the toxins, okay? It is not suggested to take any anti-laxative like mga anti-motility agents. Okay, it's good if nasa bahay ka lang, it's good that you will release all the toxins present in the body. But make sure class you're well hydrated because hydration na naman yung magiging problema mo after if ever too much yung na-excrete mo na waste, okay, or too much na na-vomit mo. So make sure you rehydrate yourself. Another disease is your toxic shock syndrome. As I said, this is associated with TSST1. These are characterized by fever, hypotension, and scarlet-informed rashes, particularly in the palm and sole, which disquamate. So this is the effect class of your super antigen because of the release of the different cytokines and chemokines. So the toxic shock syndrome class is also referred as pyrogenic exotoxin C. Your toxic shock syndrome also results to multiple organ failure, which may progress to severe shock as an evidence of renal and hepatic damage. So this is common class among women who is using with vaginal tampons during menstruation. So why is there discrimination of the skin class? Because some cytokines or chemokines class cleaves the desmoglein 1, which is a component of desmosomes present in your skin cells, okay, or your superficial cells. These desmosomes class aids in cell-to-cell addition. So what happened is this toxin or the chemokines and cytokines class cleaves that portion or your protein, leading to the loss of the superficial skin. Kaya merong mga desquamation na nangyayari. This is a picture of toxic shock syndrome. So you will see there desquamation of the skin. You also have staphylococcal scalded skin syndrome or your Ritter's disease, and this is common class with babies. Okay, with scalded skin syndrome or Ritter's disease, this is usually affects neonates, which the main virulence factor is your exfoliatin toxin, which splits intracellular bridges of the epidermis, resulting to extensive slowing of the epidermis to produce burn-like effect on the patients. Okay, here, so you will see there the slowing of epidermis, and it's like burn the patient. Okay, is napaso because of the exfoliative toxin. Because the exfoliative toxin class splits the intracellular bridges of the epidermis. You also have skin infection, so you have their folliculitis, furuncles, carbuncles, and even impetigo. So folliculitis, okay, if ever you have inflammation sa hair follicle and if spread into the tissue causing boils, that's already furuncles. And carbuncles class if there is multiple foci and tissue involvement into the deeper layer. Okay, this is now your matagtiki. And your impetigo. Impetigo, most common skin manifestation is common sa mga babies, young children less than 5-year-old. And this is highly communicable class. This is transmissible. Diagnose Staphylococcus infection or Staphylococcus aureus infection. Gram stain, and this obviously it's gram-positive in clusters. Do culture and isolation using different culture media like blood agar. So in blood agar, they may appear as beta hemolytic and golden yellow pigment. Again, not all class Staphylococcus aureus produce golden yellow pigment, but mostly the virulent strain of Staphylococcus aureus are yellow in color. Okay, you can also use selective culture medium like mannitol salt agar, which contains 7.5 to 10% sodium chloride, because again, your Staphylococcus aureus is a halodiric organism. When we say halodiric organisms, they can survive with the presence of increased concentration of salt. The mannitol there class serve as an indicator because your Staph aureus, only Staph aureus organisms ferments mannitol. So what is the pH indicator of your mannitol? It's neutral red. Oh, it's phenol red rather class. So your mannitol salt agar indicator is phenol red. So if the organisms ferment mannitol like your Staphylococcus aureus, it turns the medium from pink to yellow. Other culture medium, you have their phenylethyl agar and your colistin nalidixic acid agar. So these culture mediums are still selective culture medium. They inhibit gram-negative organism because they contain inhibitory substances that inhibits the growth of your gram-negative organism. So for example, you have your phenylethyl alcohol, and your colistin and nalidixic acid antibiotics, which inhibits both gram-negative organism. You also have chrome agar. Chrome agar is a selective and differential media for identification class of MRSA. Okay, so these media class are becoming more widely used for the direct detection class of your nasal colonization of MRSA. The medium is selective because it contains antibiotic cefoxitin. Again, the medium is selective because it contains antibiotic cefoxitin. So if the organism is resistant, obviously, it's resistant to cefoxitin. Okay? So, the addition of chromogenic substrates class will yield color to the organism. So if ever the organism class is MRSA, the positive growth or the colony growth class is color mauve or pink in color. And if ever you see mauve or pink in color, then that's probably MRSA. So for example, this one, these are MRSA. The rest are not. Maybe other organism or other bacteria. So, yung chrome agar class, para siyang preliminary identification. So it will give you already an idea that that is an MRSA or not. So this is just an algorithm of what are the tests, okay, for Staphylococcus. So you have there Staphylococcus. The next, after knowing, diba, Staphylococcus from Micrococcus, so you need to perform coagulase test. So positive for coagulase test is your Staphylococcus aureus, while negative are your Staphylococcus epidermidis and saprophyticus. We call this group class as coagulase negative staph or your cons. Okay, so these are being further tested using antibiotics. So you have there the novoviacin. Novoviacin sensitive is your Staphylococcus epidermidis, and novoviacin resistant is your Staphylococcus saprophyticus. So let's discuss first coagulase test. Coagulase test class, the purpose for that is coagulase is an enzyme that converts soluble fibrinogen into soluble fibrin. Again, this is the main principal virulent, or the principal virulence rather, of your Staphylococcus aureus. So Staphylococcus aureus is the only significant human pathogen that possesses coagulase enzyme. So you have two types of coagulase class. You have cell-bound coagulase and free coagulase. So these are detected using different methods. So for coagulase test, you have tube method and you have the slide method. So this is the principle. The fibrinogen, because of the coagulase enzyme, it converts to fibrin. Positive results for coagulase test class is fibrin formation, while negative result is smooth suspension or uniform suspension. So how do we perform coagulase test? Okay, coagulase test is being performed using two methods, either slide method and a tube method. The slide method class detects cell-bound coagulase. So if you have a slide class, for example, this is your slide, you place there 3 drops of plasma, okay, and you get a pure culture. This is your Staphylococcus. You get colonies onto the slide, and then you mix. If you see fibrin formation or agglutination, then that is positive for coagulase. But if the mixture class is smooth, you will see there is no agglutination class, then that is negative. Okay, another test or another method in detecting coagulase test is your tube coagulase. So the same manner, you have there the tube, you put 3 to 5 ml of plasma, and you add your colonies, your suspected colonies for staph. You mix that one and incubate that for 4 hours. Okay, but you check this growth class every 30 minutes. You check the reaction every 30 minutes. Why? Because remember class, your Staphylococcus has staphylokinase enzyme. Your staphylokinase enzyme will also lyse the fibrin formation, di ba? So, it may cause false negative results. So, that is why it is very important to check the reaction every 30 minutes. But, do not extend the coagulase test class or the tube coagulase test beyond 4 hours, because sometimes it will give you false negative results na because of the staphylokinase enzyme. Your tube coagulase also class is a confirmatory test, okay? Because there are organisms class that are positive for slide coagulase but are negative for tube coagulase, like your Staphylococcus lugdunensis. Your Staphylococcus lugdunensis also produce coagulase enzyme, but they are negative with tube coagulase. That is why it's very important, if ever positive ka for slide coagulase, perform also tube coagulase. If ever negative naman for slide coagulase, you need to perform tube coagulase. So this should be hand in hand. Always use rabbit plasma class as the source of plasma, because this has less antigen or antibody rather present, which can cause erroneous results. But if ever class rabbit plasma is available, we can always use plasma, but make sure the anticoagulants used for that plasma class is EDTA. Do not use citrate class. Okay, citrated blood, because citrated blood can cause erroneous results. So always use the EDTA tube. Other tests, you also have your thermonuclease test. So the purpose of this test is to differentiate between the two organisms. Rapid test to differentiate the two organisms. Your Staphylococcus aureus contains heat stable thermonuclease, and coagulase negative test does not. So thermonuclease test in general also test Staphylococcus aureus from coagulase negative Staphylococcus. So the positive result class is pink zone or clearing at the edge of the well with a darker blue ring at the outer periphery. So this is your positive results for thermonuclease test. Biochemical test, you mannitol salt fermentation test. As I said, only your Staphylococcus aureus ferments mannitol. The rest does not ferment mannitol. You also have tellerite glycine agar, in which your Staphylococcus aureus produce jet black colonies. You have there the Bogsper-Scour test, in which your Staphylococcus aureus yields positive reaction. So you have there the pink color formation because of the product acetoin. We'll discuss more of this class as we go to the biochemical testing topic. And Dine's test, so positive for clear or zone around the test organism. So the picture. So these are your tellerite agar. This is your mannitol salt agar. Okay, so this is your Staphylococcus aureus, and this is your Staphylococcus epidermidis. See, there is different because your Staphylococcus aureus ferments the mannitol, while your Staphylococcus epidermidis does not ferment mannitol. And again, the pH indicator for this one is phenol red. This is your tellerite agar. So you see there black colonies. This is your Bogsper-Scour test. So this is the positive results because of the byproduct acetoin. And this is your Dine's test. So positive results for this one here for Staph aureus. Other test class includes tests. You have there the latex agglutination test, which detects proteins, protein A, okay, which is useful in detecting altered penicillin binding protein and oxacillin resistant strain. These are advantage for both Staphylococcus aureus and coagulase negative staph. You also have molecular tests by using nucleic acid probes or PCR amplification. This is used to detect or to identify your MIC-A gene. Okay, this is the gold standard class for MRSA detection. So what are the treatment of choice for Staphylococcus aureus? Penicillin is the drug of choice, but again, there are organisms that are resistant to penicillin, like your MRSA. So these are your penicillin resistant strain. Okay, so you give vancomycin as the drug of choice for isolates that are resistant to penicillin derivatives. So what are the penicillin derivatives? You have there naftalin, oxalin, and methicillin. So for antimicrobial susceptibility you have there the vancomycin agar screen and oxacillin screen plate. So, your vancomycin agar screen plate detects if the organism is vancomycin intermediate or vancomycin resistance. So, using microdilution class, di ba? Your vancomycin agar screen, if ever the result is more than 16 microgram, if the MIC is more than 16 microgram per ml, then that is considered as resistant. Okay? But if the vancomycin class is less than 8 or 2 to 4 lang siya, that is vancomycin sensitive. Oxacillin screen resistant class used to detect screen MRSA clinical sample. Okay? So, positive, growth of more than one colony. Negative, absence of growth. So, you have also cefoxitin disc diffusion, which is the prepared method for detecting resistance in both S. aureus and S. lugdunensis. Because, again, S. aureus and S. lugdunensis are coagulase positive organism. So, again, the ZOI, remember the zone of inhibition, if ever less than 21, so that is resistant. So, automatically, your organism is resistant. Pag more than 21, then that is sensitive. So, you have MSSA. Double disc diffusion, remember the letter D, the D zone test or the D test. It detects inducible clindamycin resistant in staph. Okay, so positive results, D is formation. Absence of D formation is sensitive for clindamycin. Okay, because your erythromycin class and clindamycin shared the same mechanism of resistance. Diba? You have the efflux pump and the altered target. So it's very important class to detect if there is inducible clindamycin resistant, especially if the erythromycin is resistant. So if the erythromycin is resistant class, automatically check the clindamycin as well, susceptibility. If the susceptibility of the clindamycin is sensitive while your erythromycin is resistant, then you need to perform D test. Okay? So after performing D test, if you will not see deformation on the clindamycin, then therefore only your erythromycin is resistant, but your clindamycin is sensitive. But if you see the deformation class, okay, deformation meaning your clindamycin is resistant, same with your erythromycin. So report both antibiotic as resistant. So now let's go to Staphylococcus epidermidis. This is another species of staph. Okay? So this is not coagulase positive but rather coagulase negative organism. So let's discuss some coagulase negative organisms that are still pathogenic to you. Staphylococcus epidermidis, this represents 50 to 80% of all coagulase negative staph. Okay? So these organisms have traditionally been considered as a skin contaminants, and their recovery from culture doesn't always indicate the presence of disease. That is why it's very important class if ever you become medical technologist later and assigned in clinical microbiology. You need to consider if Staphylococcus epidermidis isolate is really pathogenic or not. If ever your culture is pure culture of Staphylococcus epidermidis, then that might be the causative agent. But if the organism of your culture medium is mixed, okay, you go for the most pathogenic organism. So if you see gram-negative bacilli, then report the gram-negative bacilli. Do not report the Staphylococcus epidermidis organism. Okay. So your Staphylococcus epidermidis class accounts for the large nosocomial and opportunistic pathogen in immunocompromised patients, and the major habitat is your skin and mucous membrane. So your Staphylococcus epidermidis is usually found transmitted rather by to the stereocyte by implantation of medical devices like shunts, prosthetic devices. Human also serve as exogenous and endogenous source of infection. So the disease associated with Staphylococcus epidermidis class is bacteremia associated with the use of catheter or orthopedic prosthetic implants, CNS, shunts, or pacemaker. So this organism class is transferred to human with the use of devices, because these organisms class, the virulence factor of this organism is usually slime formation or capsule, okay, formation, because Staphylococcus epidermidis class contains capsule, and this capsule aids the microorganism to resist phagocytosis, and also the slime formation also adheres the help the organism to adhere to certain surfaces. Okay, so Staphylococcus epidermidis also cause associated with stitches abscess, endocarditis, or even UTIs. So for culture characteristics, Staphylococcus epidermidis is usually porcelain white colonies. By the way, the old name of Staphylococcus epidermidis is Staphylococcus albus, ALBUS, which means white. Okay, but it was changed by the Bacteriology committee to epidermidis because this is common, okay, in the body. Biochemical characteristics, you have their catalase positive. They are non-mannitol fermenters, so they do not give yellow colonies using MSA. They are coagulase negative, thermonuclease negative, and what is important to note, class, they are novobiocin sensitive. So what is the zone of inhibition that you have there? It's 16 to 27 mm. So now let's go to Staphylococcus saprophyticus. We're done with Staphylococcus epidermidis and Staphylococcus aureus. By the way, for Staph epidermidis, you have their aminoglycosides, gentamicin and tobramycin, cephalatin, rifampicin, and vancomycin. Now let's go to Staphylococcus saprophyticus. Staphylococcus saprophyticus is also coagulase negative staph. So the habitat is human skin, periurethral, and even urethral area. Your Staphylococcus saprophyticus class is the second most common causative agent of UTI, because your first, diba, your primary pathogen associated with UTI is your Escherichia coli. But the second most common class is your Staphylococcus saprophyticus. Okay, you have, this is commonly seen among sexually active young women. The virulence factor of Staphylococcus saprophyticus includes adherence to the urethral cells by means of surface-associated protein and lipoteichoic acid, and also hemolysin and production of extracellular slime. It infects human through sexual intercourse and contact with animals. So, again, Staphylococcus saprophyticus is the second most common cause of urinary tract infection among human. Your Staphylococcus saprophyticus, by the way, the disease is known as honeymoon cystitis. So honeymoon. So this is the causative agent of honeymoon cystitis. So during board exam, if merong mga tanong na honeymoon cystitis causative agent, ito yung sagot, saprophyticus. Okay? So Staphylococcus saprophyticus can cause cystitis. So what are the symptoms of cystitis? You have their burning sensation when urinating, also bloated feeling with sharp razor pains in the lower abdomen, and razor-like pain during sexual intercourse. Since this is cystitis class, this is non-gonococcal. It can also cause non-gonococcal urethritis, and it can also cause uncomplicated urinary tract infection. So, for Saprophyticus, usually it appears as opaque, creamy white, non-hemolytic colonies. Sometimes there are also Saprophyticus class that are yellow or orange in colonies. In order to differentiate between your epidermidis and your saprophyticus, you need to perform novobiocin test. Since these two are coagulase negative, so we need to differentiate the two. So in order to differentiate the two, we need to perform novobiocin test. And resistant to novobiocin, meaning hindi siya umabot sa 16 to 27 mm, then that is resistant. That is your Staphylococcus saprophyticus. So, novobiocin and allylic acid resistant staph. Of choice for saprophyticus, you have your ciprofloxacin, trimethoprim, and quinolones like norfloxacin. Norfloxacin class is only used for UTI. Okay? You cannot use this as treatment for other area of infection like blood or bacteremia or disease associated with respiratory. No. Norfloxacin is only used for UTI infection or urinary tract infection. You also have Staphylococcus lugdunensis. Why I include this? Because it is a coagulase negative staph. Okay? It is only considered as coagulase negative using tube method. Okay? It gives positive results class for slide method. That is why I told you kanina it's very important to perform tube method because Staphylococcus lugdunensis sometimes may appear as Staphylococcus aureus. So, ma-miss out siya. So, it is important to perform tube method. Its Staphylococcus lugdunensis class are more aggressive than other coagulase negative staph in terms of infectivity. It also contains MECA gene that codes for oxacillin resistance. So in order to detect this one, we need to perform the cefoxitin screen. Okay, so Staphylococcus lugdunensis class appears as cream to yellow color and may be beta hemolytic. So usually the same as staph, but again, Staphylococcus aureus, the same as Staphylococcus aureus. But again, they are not coagulase positive, they are coagulase negative by tube method. Okay, so here are the lists of novobiocin susceptible coagulase negative staph and novobiocin resistant staph. But it's very important to note, class, that only this organism and this organism, as well as hemolyticus, are the most common pathogen associated with human. While for the novobiocin resistant are this one, saprophyticus, because others class are just contaminants or sometimes these are zoonotic in nature. So the table here class summarizes the three most important or the three common species under Staphylococcus aureus in association with their laboratory diagnosis. So please do familiarize this table. Okay, so now let's go to the second part of cocci. We have the genus Streptococcus. So we're done with genus Staphylococcus or your gram-positive cocci in clusters. Now let's go to genus Streptococcus, your cocci in pairs and in chain. So for genus Streptococcus, for generalities of Streptococcus, these members are gram-positive cocci, so meaning they still take up the primary stain, which is your crystal violet. These are usually found in pairs and in chain. Pairs, we call it as diplococci, diplo meaning pairs, chain, Streptococcus. So common example of your pairs class are your Streptococcus pneumoniae, which appear as lancet shape. Okay, these are the characteristics of your Streptococcus pneumoniae. Your Streptococcus again is catalase negative, so they are being differentiated by your staff with the use of your catalase test. Again, as a review, catalase test, the main reagent is your 3% hydrogen peroxide, and the positive result is effervescence or bubbles formation. Still, your Streptococcus class is facultative anaerobes. These are non-motile, non-sporiformer, and non-encapsulated except for one. You have your Streptococcus pneumoniae. Streptococcus pneumoniae is encapsulated type of strep. So, your Streptococcus class consists a large family of medically important species, including your Streptococcus species and your Enterococcus species. So, the organisms included in this genus are further differentiated based on the cell wall. So, the cell wall with the presence of C carbohydrate. So, by detecting the C carbohydrate protein, or we call this as Landsfield grouping. So, here we detect C part of the carbohydrate. C carbohydrate, which is found on the cell wall. Okay? So we call this as Landsfield groupings as well. We also group Streptococcus by hemolytic pattern. So remember your alpha, beta, and gamma hemolysis. So we call this grouping for beta and alpha hemolysis as Brown and Smith classification. So for hemolysis, Brown and Smith classification. There. While for cell wall structure, you have the Landsfield classification. We also group them according to physiologic characteristics like temperature and biochemical characterization. So generally, class, your Streptococcus organism are part of normal flora. These are encountered in clinical specimen as contaminants or as component of mixed culture with minimal or unknown clinical significance. So your Streptococcus class is transmitted via person to person by various means, with the indirect or with the direct transmission. It is also transmitted by colonizing strains, gain entrance to normal sterile site, just like your staph. Normally, they are normal flora. They will not cause disease, but once they gain inside to a sterile body site, they can cause diseases causing bacteremia or sepsis. Okay. They can also gain entry to trauma, whether it's medically induced or non-medically induced, and as well as aspiration into the lungs of organism colonizing upper respiratory tract. So now let's go to your Streptococcus. Classification is based on temperature. So this is your academic or Burgess classification. So your staff are classified into four. You have your pyrogenic because this can induce fever. Okay, these organisms also elicit pyrogenic toxins. So common examples, you have their Streptococcus pyogenes, group C and group G Streptococcus. So for pyrogenic organisms, usually these are beta hemolytic and they will never grow at 10 degrees Celsius nor at 45 degrees Celsius. So they will only grow at 37 degrees Celsius. Okay. Next group is your viridans. So your viridans grows both at 45 to 35 degrees Celsius. Your viridans groups are not part of Landsfield classification because they do not possess C carbohydrates on their cell wall. And they may be alpha hemolytic. So your viridans are indigenous microflora of the upper respiratory tract in humans. So these are common class normal flora. Common examples of your viridans, you have their Streptococcus mutans, Streptococcus mitis, and Streptococcus salivarius. So Streptococcus mutans is the common cause of your dental plague. Lactic, these are organism or Streptococcus class that grows at 10 degrees Celsius and 37 degrees Celsius. These are usually non-hemolytic and as Lancefield and antigen. So common example as your S. lactis. So S. lactis is commonly present as contaminants sa normal coagulation and souring of milk. Your Enterococcus, these organisms grows at 10 degrees Celsius, 45 degrees Celsius, and even at 37 degrees Celsius. So these are endogenous microbiota of the human intestine. So common example is your Enterococcus fecalis. Another classification, as I said, is based on hemolytic pattern, and we call this classification as Brown and Smith classification. So you have there alpha hemolysis, beta hemolysis, and gamma hemolysis. So for alpha hemolysis, these are characterized class again by a greenish, okay, greenish hemolysis around the colonies. This is due to the incomplete partial destruction of red blood cells. So common examples, you have your Streptococcus viridans and Streptococcus pneumoniae. So later on, we'll know how to differentiate these two since these two are alpha hemolytic organism. The next classification or the next type rather is your beta hemolytic. Okay, your beta hemolytic are characterized by clear colorless zone of hemolysis, and this is because of the complete destruction of the red blood cells, which is the red blood cells are being used, the iron component or the hemoglobin component of the red blood cells are being used by the organisms in order to grow. So the common examples there, you have your Streptococcus pyogenes and your Streptococcus agalactiae. So these are beta hemolytic organisms. So we'll discuss later how to differentiate the two since these are two beta hemolytic organisms. Another one is your gamma hemolysis. These are non-hemolytic on blood agar plate. So common example, you have there Enterococcus fecalis as well as Streptococcus bovis. Streptococcus bovis is also non-hemolytic. Your gamma class, okay, since this does not have hemolysis on the blood agar plate, does not change the RBC. They do not destroy the RBC. This organism does not destroy the RBCs. Okay. Here, these are the picture of your beta hemolysis or complete destruction of red blood cells. You have their alpha hemolysis or the incomplete or partial destruction of your red blood cells, and your gamma hemolysis. Okay, so no destruction of red blood cells at all or no hemolysis at all. Classification class is your Lancefield classification. Lancefield classification got its name because of the discoverer, which is Rebecca Lancefield. Rebecca Lancefield class developed the classification by detecting the C carbohydrate antigen found on the cell wall. So how did we perform this one? The C carbohydrate can be extracted from the streptococcal wall by using class organism in diluted acid and heat suspension for 10 minutes. Okay, so you have their letters and the corresponding organism. Take note class that Streptococcus pneumoniae and viridans class do not have cell wall carbohydrates, so therefore they are not grouped according to Lancefield classification. Okay, again, Streptococcus pneumoniae and Streptococcus viridans do not have cell wall antigen, therefore they are not grouped according to Lancefield classification. The rest, they possess cell wall antigen. So Group A class is your Streptococcus pyogenes. Group B is your Streptococcus agalactiae. So if you still remember, these two organisms are beta hemolytic. Okay? So Group A and Group B are beta hemolytic. Group C, you have their Streptococcus equisimilis or Streptococcus dysagalactiae subspecies equisimilis. Okay? Streptococcus sulpidicus and Streptococcus equi. You also have Group D. Group D class is further classified into two. You have the Group D Enterococci and Group D non-Enterococci. Group D Enterococci, they have their Enterococcus fecalis and Enterococcus faecium. And the non-Enterococcus, you have your Streptococcus bovis and Streptococcus durans. You also have group G, your Streptococcus anginosus. So here, this table here is a classification table, a summary of the two classification. You have the Landsfield classification, the Brown and Smith classification, and the organism. So A, B, and C, your Agalactiae subspecies Equisimilis are beta hemolytic against Pyogenes, Agalactiae, and your Streptococcus dysagalactiae, this is dysagalactiae class, subspecies Equisimilis are beta hemolytic. For group D, it can be beta, alpha, or non-hemolytic. And for the Streptococcus pneumoniae, since they do not have cell wall antigen, carbohydrate on the cell wall antigen, they are not classified according to Landsfield, but they still have hemolytic pattern. For Streptococcus pneumoniae, it's alpha hemolysis. For Streptococcus viridans, it can be alpha hemolysis or non-hemolytic at all. So, these are the different class Streptococcus of medical importance. So, we'll discuss each species one by one. So, let's start with your Streptococcus pyogenes or your group A, beta hemolytic streptococci, or your JAS, okay, your GAS. Group A, Streptococcus pyogenes, produces large zones of beta hemolysis around the colonies, and the main human pathogen associated with local or systemic invasion, and it can also cause post-streptococcal immunologic disorders. Okay? Your Streptococcus pyogenes class is not considered as human microflora, and this is acquired class through droplets such as coughing and sneezing. The habitat of your Streptococcus pyogenes, skin and upper respiratory tract, carried on the nasopharyngeal and sometimes in anal mucosa. Your Streptococcus pyogenes is prone to progression with involvement of deeper tissues and organs, and characteristic that has earned a designation of flesh-eating bacteria, or in some textbook, fever-producing bacteria. Your Streptococcus pyogenes is also known as fever-producing bacteria because it possesses pyrogenic exotoxin. So, for cultural and biochemical characteristics, your Streptococcus pyogenes class is gram-positive, spherical in shape, and arranged in chain. So, therefore, this is an example of Streptococci. Okay? These are non-motile and non-spore former. Most strain class produces capsule composed of hyaluronic acid. The hyaluronic acid class is a weakly immunogenic protein which prevents opsonization and phagocytosis, and it also masks an antigen properties class, antigenic properties. So, your gas or your Streptococcus pyogenes is fastidious, and it requires enriched media for primary isolation. That is why it will grow better with the presence of blood. Okay, so it will grow better on blood agar plate. You should incubate this one with 5 to 10% CO2 because these are also caphnophilic organism. Okay. It ferments wide variety of carbohydrates with the production of lactic acid with or without gusts. So on a blood agar plate, your Streptococcus pyogenes class appears as circular, translucent, grayish to pallescent qualities, whether it's matte or glossy, large zones beta hemolysis. Again, it's beta hemolysis. The beta hemolysis class is because of a certain toxin known as your streptolysin. So we'll discuss more of that as we go along, I think. I have a slide, I think, about streptolysin later. So here, because of the cause of the beta hemolysis is because of the streptolysin. So your Streptococcus is catalase negative, PYR positive, Uh, PYR hydrolyzes the L-pyridonyl beta naphthalamide and bacitracin sensitive. Take note of these tests. Okay, so bacitracin. Okay, so what is PYR? So your Streptococcus pyogenes is PYR positive. This is a test class used for group A Streptococcus. It demonstrates the presence of these certain enzyme, pyridinyl arylamidase. The positive result class is formation of deep cherry red color within the minute after the addition of the reagent. Okay? So again, PYR is for group A strep. Another test is your bacitracin susceptibility test. So positive result for bacitracin susceptibility test is any presence of ZOI. So whether it's more than 6, it should be more than 6 class, of course, diba? Because the 6 mm is the measurement of your antibiotic days. Any presence of any measurements class of zone of inhibition or presence of zone inhibition in general, okay, indicates that the organism is susceptible. So for beta hemolytic organisms class, if ever you do bacitracin and it is susceptible, you always think of Streptococcus pyogenes. If ever it's not beta hemolytic, then that might be others. Okay? So your bacitracin susceptibility is used to differentiate Streptococcus pyogenes from Streptococcus agalactiae. So positive or sensitive is your Streptococcus pyogenes, resistant is your Streptococcus agalactiae. So again, the sensitive result is always presence of zone of inhibition. So this is your PYR. So see the color formation after the addition of the reagent. So positive cherry red in color. And this is your bacitracin test. So any zone of inhibition class possessed there indicates rather susceptible, and meaning that is your group A Streptococcus. Your bacitracin, by the way, is also known as taxo A. So in some textbook, bacitracin refers to taxo A, and the number of units class, if asked in the board exam, is 0.04 units. That's the number of concentration of your antibiotic text for bacitracin. So now let's go to the antigenic structure. The first one is the C carbohydrates. Okay, since your group A strep contain group as A for Landsfield classification, so it possesses A antigen on the C carbohydrates. So the C carbohydrate are specialized polysaccharide or teichoic acid found in the surface of the cell wall. Group A specific cell wall antigen because it's group A strep. And this is the uses for basis of serological classification using Landsfield method. So how do we perform again the C carbohydrate? We extract strep and dilute with acid and heat for 10 minutes. Other antigenic structure, you have your M protein. By the way, class, the major virulence factor of your Streptococcus pyogenes or your gas is your M protein. This is the major virulence factor of gas. Your gas appears as hair-like projection on the streptococcal cell wall, and it aids immunity to infection with group A Streptococcus related to presence of type-specific antibodies to M protein. So, since this is a hair-like projection class, it is known also as febrile antigen. Okay? Your M protein primarily class is for adherence to mucosal cell, and it has also a antiphagocytic property which block complement cascade system. You also have your T protein. Your T protein are acid labile and heat labile. They are obtained from Streptococcus by proteolytic digestion, which is rapidly destroys M protein. So it permits differentiation of certain types of Streptococci by agglutination of specific antisera. By the way, class, you have different numbers of M protein. Your M protein 1 is primary, can cause rheumatic fever. While your M protein 1 and 2 can cause post-glomerulonephritis. So I'll be discussing that again later. So aside from the antigenic structure, you also have the cellular components. You have the lipoteichoic acid. Your lipoteichoic acid allows the organism to cling to the epithelial surfaces, and it has a cytotoxic effect which destroys both RBCs and WBCs. Okay? So, diba, our respiratory tract is made up of ciliated pseudostratified columnar epithelial cells, if you still remember your histology. So the pseudostratified structures class, or the cilia rather, of the epithelial lining also aids class, diba, that prevents microorganisms to cling into. But your Streptococcus pyogenes class has this component which allow the microorganisms to cling on that particular area. Okay, so they are not easily brushed off by the cilia present on the respiratory epithelium. So also have their M protein. Again, the M protein is the major virulence factor. And the capsule. Your Streptococcus pyogenes class has also, some strain also have capsule which are made up of hyaluronic acid. And again, if the organism has capsule, it has antiphagocytic properties and promotes invasiveness of the organism. Your Streptococcus pyogenes also have streptodernase or streptococcal deoxyribonuclease. Okay, so they are the one facilitates the infection spread by liquefying the pus class, because the activity of your streptodernase class is to decrease the viscosity of known DNA solutions. So it facilitates removal of purulent oxidates and discharges. So your DNase class, there are 4 types. Usually it's A, B, C, and D. So primarily, your streptodernase lowers the viscosity of oxidates, giving the pathogenic class to be more motile and spread. To be more mobile and spread towards the deeper tissues. Your streptokinase, this is the same with your staphylokinase. It is still fibrinolysine, meaning it lyses fibrin clot. These are produced by group A Streptococcus. It binds to plasminogen class to plasmin and inactivates class host blood factor to dissolve fibrin clot formation. So, streptokinase class is also a treatment for pulmonary embolism, coronary artery, and venous thrombosis because it lyses the clot nga. Okay? So, these are also given as treatment to this type of disseminated coagulation infection, disseminated intravascular coagulopathies. You also have hyaluronidase, the same characteristics class with your Staphylococcus hyaluronidase. Still, it is a spreading factor, so it split hyaluronic acid, which is an important component of the ground substance of your connective tissues. So, it solubilizes the ground substance of the host cell, causing the microorganism to spread further or to spread deeper to the skin, to the deeper tissues. You also have this piperidine nucleotidase. So these enzymes class are elaborated in the environment and related to organisms' ability to kill leukocytes, polymorphonuclear cells, and macrophages. So this is the same action with your PBL, your Phantom Valentine leukocidin in staph. But what is the difference between this porphyridine and nucleotidase class? This organism does not produce necrosis. Okay? So, this organism naman, this extracellular enzyme class does not produce necrosis. But your PBL, your Phantom Valentine leukocidin, produce results to necrosis. But eto, hindi. So, another factor or valence factor is your hemolysin class. So your hemolysin, you have two types of hemolysin. You have your streptolysin S and your streptolysin O. So your streptolysin S are oxygen stable. So S, they're stable. These are non-antigenic. So it cannot cause infections or cannot cause disease. But this is the hemolysin class responsible for the subsurface hemolysis during aerobic condition. Okay, so ito yung makikita mo sa subsurface or on the top of the culture medium. The streptolysin O, these are oxygen labile, and these are antigenic class. Take note, streptolysin O is antigenic. So when you say antigenic, it is immunogenic and responsible for the hemolysis naman class on the deeper portion of the medium. So in order to see whether the organism is producing streptolysin O, you need to stab the culture medium. Diba? Aside from streaking the culture medium, you need to stab. So, imo siyang i-deep gamay class. Imo siyang point gamay to imuhang inoculating loop. Okay? You need to stab the agar in order to see whether the organism is producing streptolysin O or not. So, your streptolysin O, by the way, is being used to detect infections, particularly gas infection. So, this combines quantitatively with anti-streptolysin O. So, ASO. This is an antibody that appears in human following infection with any Streptococcus that produce streptolysin O. Okay? So, ASO titer is usually used class to detect whether that particular person is infected with gas or your Streptococcus pyogenes. Okay? So, take note that a serum titer excess in 160 to 200 units is considered abnormally high and suggests a recent infection with Streptococcus pyogenes. You also have erythrogenic toxin. Your erythrogenic toxin, which causes fever, or your pyrogenic toxin, you have your exotoxin A, B, and C. Okay? Your erythrogenic toxin also act as super antigen. So as discussed kanina, it stimulates T-cell productions, T-cell response by binding to the class 2 major histocompatibility complex, which activated T-cell release of cytokines and mediate shocks and tissue injury because of the uncoordinated release, because these are non-specific. Okay? Diba? If super antigen, it bypass the ordinary process. So, unregulated na siya, causing massive release of cytokines. And if there is massive release of cytokines and chemokines, it will always result to toxic shock or even tissue injuries and inflammation because of the increased concentration of your phagocytic cell. Your erythrogenic toxin also is associated with streptococcal toxic shock syndrome and even scarlet fever. So the table here is just a summary of what I said a while ago about Streptococcus pyogenes. So just read it. To diseases associated with your Streptococcus pyogenes or your group A strep. The most common class disease associated with group A strep is pharyngitis or your streptococcal sore throat. So this is common in infants and small children. So the sore throat occur as subacute nasopharyngitis with a thin serous discharge. The patient also experienced little fever but with tendency of infection extend to the middle ear and mastoid. Cervical lymph nodes are also enlarged and illness usually persists to week. Okay? So pharyngitis class is spread via air droplets or close contact. In older children and adults class, this is more acute and characterized by intense nasopharyngitis, tonsillitis, and intense redness and edema of the mucous membrane with purulent oxidates, enlarged tender cervical lymph, and high fever. Okay? So, how do we diagnose this one? Pharyngitis class is usually diagnosed, if you still remember your specimen collection topic, this is being diagnosed using throat swab. And after getting throat swab, you do direct antigen detection or even culture. So here, you see inflamed class tonsils. This is your tonsils, kani sila. This is not your tonsil class, this is your uvula. Okay, uvula. This one is not your tonsil. Ito yung tonsils. Okay? Ito yung magi-enlarge if meron kayong pharyngitis. This one here, we call it uvula. U-V-U-L-A. Okay. Next, you have skin infection associated with Streptococcus pyogenes. You have their erysipelas, impetigo, cellulitis, and necrotizing fasciitis. So your erysipelas class, usually, for direct skin infection class, Streptococcus pyogenes enters the patient obviously via skin, and usually the mode of transmission is skin aberrations or mga wound, surgical incisions. So erysipelas class are acute infection of the dermal layer. Usually, it is characterized by painful, swollen redness. Your impetigo, okay, your impetigo consists of superficial vesicles breakdown, and it is usually characterized by pus and later encrusted. Impetigo, as I said kanina on your Staphylococcus, these are still highly communicable. Okay, these are usually present in hot and humid climates. Your cellulitis, this follows infection associated with mild trauma, burns, or even surgical incision. For cellulitis class, the lesion is not raised and the line in between that involves tissue is indistinct. For cellulitis, still, this skin infection class is contagious. Okay. For necrotizing fasciitis, this is an infection of the subcutaneous tissue and fascia. The group A Streptococcus causing necrotizing fasciitis are sometimes referred as flesh-eating bacteria. So, your Streptococcus pyogenes class also cause galloping gangrene. Necrotizing fasciitis is also known as galloping gangrene because iba din yung clostridial gangrene na causative agent. So this is your erysipelas and impetigo caused by JES or your group A strep. Your necrotizing fasciitis as well as your cellulitis. So if you see there, redness, okay, and your flesh-eating bacteria there. Your Streptococcus pyogenes also release toxin, class like streptococcal toxic shock syndrome. These are associated with streptococcal toxic shock syndrome toxin. These are characterized by shock, bacteremia, and respiratory failure, similar to staphylococcal toxic shock syndrome. Okay, this first manifestation is usually soft tissue infection, followed by necrotizing fasciitis and bacteremia. For scarlet fever, this occurs in association with Streptococcus pharyngitis with skin or soft um, tissue infection. The rash appears on the trunk after 24 hours of illness and spread. Usually, spread involves extremities. These two types of infection, by the way, class, are clinically overlapping diseases. So, as I said, your Streptococcus pyogenes class can cause post-streptococcal diseases. So, for pharyngitis and skin infection that are not treated, that are caused by Streptococcus pyogenes, it can also cause complications. And these are the two common complications. You have your acute glomerulonephritis and your rheumatic fever. Your acute glomerulonephritis and rheumatic fever class are characterized by antigen and antibody mediated ni sila, because your kidney class, particularly your glomeruli, okay, has M protein, as well as your heart has M protein. So the organisms class, diba, possess M protein. So if ever you have a history of pharyngitis or skin infection, automatically, diba, your body will develop antibodies as part of the immune process, immune response. So your body will develop memory cells for that M protein. So on the succeeding infection class, on the succeeding infection, the memory cells, instead of attacking the actual pathogen, it will now attack to the kidney or even sa imuhang heart, okay, causing now these two diseases. So let's start with acute glomerulonephritis. So your acute glomerulonephritis class is initiated again by antigen-antibody complex in the glomerular basement membrane. By the way, acute glomerulonephritis is also known as Bright's disease. P-R-I-G-H-T. Bright's disease. Okay? So, these are inflammatory disease of your renal glomeruli, and primarily, it is caused by disposition of antigen-antibody complexes in the kidney. Okay? So, your acute glomerulonephritis happens class 1 to 4 weeks after skin infection. Okay? Skin infection caused by Streptococcus pyogenes. And these are characterized by blood and protein in the urine, edema, high blood pressure, urea nitrogen retention, and serum complement levels are also low. Your high blood pressure is a result class of, obviously, lack filtration. Your acute glomerulonephritis is caused, diba, by Streptococcus pyogenes, because your Streptococcus pyogenes class produce nephrotoxin. Because some of the organisms class produce nephrotogenic toxin, particularly the M protein M2, 4, 6 sila. These are your nephrotogenic strain of your Streptococcus pyogenes. Your rheumatic fever, on the other hand, rheumatic fever, this is the most serious sequelae of your Streptococcus pyogenes. Let me erase. Rheumatic fever class is again the most serious sequelae of Streptococcus pyogenes because it damaged the heart muscles and valves. So, this is characterized class by inflammation of the heart, joints, blood vessels, because the organisms class M protein cross-react with the tissue antigen in the heart. Okay? This happens often preceded by Streptococcus pyogenes infection 1 to 4 weeks earlier. Okay? And the patients with more severe streptococcal sore throat have greater chance in developing rheumatic fever. If kanina, say, acute glomerulonephritis is caused week after skin infection or pharyngitis, pwede din pharyngitis class, rheumatic fever is only common as complication after pharyngitis. Okay? So, typical signs and symptoms for rheumatic fever, you have fever, malaise, migratory non-suppurative polyarthritis, and evidence of inflammatory of all parts in the hearts. So, causing endocarditis, which you will see class thickened and deformed valves. And also, you will also see scar tissue, which is known as Ascough bodies. So, treatment of choice, you have their penicillin and erythromycin, since beta hemolytic, usually beta hemolytic organism are still susceptible for penicillin class. Allergic patients to penicillin, they are given with clindamycin, erythromycin, and cephalexin. Also, you can also give benzathine penicillin given for 10 days at via intramuscular administration. Now let's go to Streptococcus agalactiae. Your Streptococcus agalactiae is your group B strep. Okay? Strep, they possess group B polysaccharide antigen on their cell wall. These are still beta hemolytic class. And your Streptococcus agalactiae are normal flora of the vagina class and the lower GIT. Okay? This is an important cause of infection in the OBGYN patients. And the major virulence factor of your Streptococcus agalactiae is a capsule which composed of sialic acid. This is an important cause of OBGYN patient class because pregnant women should be screened with this organism, your GBS screening. We call it as GBS screening. These are usually done in 35 to 37, I think 35 to 37 weeks of gestation. That's approximately 6 to 7 months of pregnancy to detect whether the mother is positive for or carrier of Streptococcus agalactiae or not, because Streptococcus agalactiae class can cause neonatal meningitis sa baby. So your Streptococcus agalactiae, morphologic and cultural and biochemical characteristics. Still, your Streptococcus agalactiae is a gram-positive cocci, and it is arranged as pair or in chain. They are non-motile and non-spore-forming. They are encapsulated, and the capsule again is made up of sialic acid, which is the primary virulence factor. In a blood agar plate, they are similar with your group A strep, but it has a narrow zone of beta hemolysis, while your group A strep is wider zone of beta hemolysis, but still they are beta hemolytic. Okay, they are catalase negative, COMP test positive. The COMP there stands for 4 different person. Your Kristen Atkins Munch Peterson test, hydrolase sodium hepurate, bacitracin resistant, bile soluble, and PYR negative. So I'll be discussing this later on the later slides. Your Streptococcus agalactiae also is halophilic organism, so they can grow with the presence of 6.5% NaCl. So your Streptococcus agalactiae class, again, diba, as important cause infection of the OBGYN patient or the pregnant women, because these are associated with neonates and acquired before or during birth process, which can cause class fulminant sepsis or neonatal meningitis, and also can cause respiratory distress syndrome among babies. Okay, so as I said, group B streptococcal infection are increasing among non-pregnant women as well. So the major manifestation of Streptococcus agalactiae, you have their bacteremia, skin and soft tissue infection, respiratory infection, and genitourinary tract infection. The mode of transmission includes gaining access to sterile site because again, these are normal flora, 'di ba, of the vaginal tract and your lower GIT. So if they gain entry to a sterile site, they can always cause infection. So person to person, from mother in utero or during delivery. That is why it is very important to screen pregnant women with GBS. Okay, so how do we screen GBS, class? This is done by swabbing the rectal and the vaginal area, and you place that one in a selective media. The selective media is your Todd Hewitt selective media. Your Todd Hewitt double T broth. Okay. So that's the selective media for your GBS. So clinical infections, pathology of Streptococcus agalactiae or your GBS includes neonatal meningitis, neonatal sepsis, and it can also cause endometritis, pelvic abscess, and septic shock, okay, if not treated. So there is no vaccine currently available, class, to protect against group B Streptococcus meningitis. So the only way is via detection, earlier detection. That is why pregnant women are screened with GBS. But the GBS screen, class, is not normally done or not routinely done in our country, in Philippines. But in some other countries, class, meron naman, ginagawa nila to. So how do we test group B strep? Again, one is CAMP test. CAMP test, again, as I said kanina, the abbreviation for CAMP test is your Christine Atkins Munch Peterson. So the culture medium is blood agar plate. The positive reaction, class, is arrowhead or bow tie shape of beta hemolysis near the Staphylococcus aureus growth. So this is the C here. This is your Staphylococcus aureus. This is your group B strep. And this is your another test organism. So if you cannot see, class, arrowhead formation, then that is negative. But if you see arrowhead formation, then that is positive. Okay, for CAMP test. So the principle of your CAMP test, class, is the CAMP factor synergistically act with the beta lysine of your Staphylococcus aureus, which enhances the lysis of the RBC. That is why it is important to use beta hemolytic organism like your Streptococcus beta hemolytic or your Staphylococcus, because these contains beta hemolysin. Another test is your hepurate hydrolysis test. This is used to differentiate group B from other beta hemolytic streptococci. Streptococcus agalactiae possess enzyme uricase and hepurate hydrolase. So that is why group B Streptococcus is positive for hepurate hydrolysis test. So the main principle of your hepurate hydrolysis test, hippuric acid hydrolyzed to benzoic acid and glycine with the use of hepuricase enzyme. So the reagent, take note, sodium hepurate and ninhydrine. So after the addition of the reagent, class, if you will see purple color, that is positive for hepurate hydrolysis test. So for the laboratory identification, the same with the rest of the Streptococcus, the same culture culture results, and the biochemical test, as I said, you will do hepurate hydrolysis, CAMP test positive, hepurate hydrolysis positive, and this is bacitracin negative. The treatment of choice, you have their penicillin G, ceftriaxone, and cefotaxime. and vancomycin for penicillin allergic patients. Another species class of Streptococcus is your Streptococcus pneumoniae. Streptococcus pneumoniae is also known as Diplococcus pneumoniae or your Frankel's pneumococcus. It contains a C polysaccharide, but that C polysaccharide class is unrelated, okay, to the Landsfield grouping. Remember, your Streptococcus pyogenes is not part of Landsfield grouping class. Your Streptococcus pneumoniae is a colonizer rather of upper respiratory tract and capable of spreading to lungs, paranasal sinuses, and even to middle ear infection. Middle ear, okay, causing otitis media. The mode of transmission for this type of organism is person to person with contaminated respiratory secretions. Usually, this type of infection class happens if ever the person is immunocompromised or weak, it has weaker immune system. Streptococcus pneumoniae characteristics or morphology, they are gram-positive and lancet-shaped diplococci. Okay? These are only Streptococcus, under Streptococcus family na hindi talaga siya pwedeng maging in chain. Okay? These are usually in pairs. That is why the old name of your Streptococcus pneumoniae is Diplococcus pneumoniae. Okay? These are encapsulated and demonstrated by a Killang reaction or India ink staining. The capsule class is the major virulent factor of your Streptococcus pneumoniae. These are still facultative and aero. So here, this is an electron micrograph of your Streptococcus pneumoniae. The pointed structure there is the capsule, which is the major virulent factor of the organism. So, your Streptococcus pneumoniae are fastidious organism. It requires enriched media, like your sheep's blood agar, and of course, with the presence of 5 to 10% CO2. On a blood agar plate, they may appear as small, gray, glistening colonies and tend to tip down in the center and resembles like donut later. Okay? Prolonged incubation class will lead the organisms to form donut formation. In some organisms class, if the organism contains capsule, it may be mucoid and alpha hemolytic. Okay? For organisms that are capsulated class, expect that colonies are mucoid. Again, basta capsulated ang organism, the colonies are always mucoid. And take note, Streptococcus pneumoniae is alpha hemolytic. So for pathogenicity, the major virulent factor is polysaccharide capsule, while other proteins responsible or helps the organisms to cause disease, you have your phosphoryl choline, which stimulates cells to phagocytize bacteria, protein adhesin, which mediates binding to epithelial cells of the pharynx. The organism also has secretory IgA protease that hydrolyze your IgA antimicrobial activity. Your Streptococcus pneumoniae also has pneumolysine, and it also lyse epithelial cell. The pneumolysine lyse epithelial cell. So, what are the diseases associated with Streptococcus pneumoniae? The most common class is lobar pneumonia, followed by otitis media, meningitis, and sinusitis. So, this is the most common. Otitis media class is the most common isolate, common siya for 3-year-old children. Okay? That's the meningitis. Bacterial meningitis, the common signs and symptoms, you have high fever, headache, and stiff neck in anyone over the age of 2 years. Okay? Take note of the age, 2 years above, or 3 years for Streptococcus pneumoniae. The transmission is usually respiratory fluids from infected person when they cough or sneeze, or direct contact with the secretion from nose and throat of the infected person. So this is an example of brain with Streptococcus pneumoniae infection. So for lobar pneumonia, this is the most common bacterial pneumonia among elderly patients, especially with COPD. COPD stands for chronic obstructive pulmonary disease. So lobar pneumonia is caused by person to person by respiratory droplets. The incubation period is often variable, and lobar pneumonia class is common when the patient experiences COPD or when the patient is has congestive heart failure, malnutrition, and even addicted to alcohol or alcoholism. Okay, so these predisposing factors class often destroy the immune system, diba? So smoking also is one of the predisposing factors of lobar pneumonia. And the clinical manifestation of lobar pneumonia, you have fever, chills, cough, pleuritic pain, and rusty colored sputum. So the lobar pneumonia class is characterized by presence of voluminous fluid which hastens the spread of bacteria to the lungs. So the lobar pneumonia may disseminate to the bloodstream to brain, causing bacterial meningitis. So this is an example of your rusty colored sputum, and this is your normal bronchiole and your bronchiole filled with fluids which is composed of your bacteria and your phagocytic cells. So you will see consolidation on the chest x-ray if ever the organism or if ever the patient experienced pneumonia. This is lobar consolidation. This is different from the patients with Mycobacterium tuberculosis, because for Mycobacterium tuberculosis class, you will see consolidations anywhere, or usually on the upper portion rather, because it thrives with the presence of oxygen. So what are the tests being used to identify Streptococcus pneumoniae? The first one is your optokin test. Okay, your optokin test, by the way, is known as your taxo-P. If your bacitracin is taxo-A, your optokin is taxo-P. This is the most currently widely used presumptive test for Streptococcus pneumoniae. Similar procedure, you do lone culture and you put your antibiotic disc. By the way, the chemical name of optokin class is ethyl hydrocoproin hydrochloride. That's your chemical name for optokin disc. Take note of this name because this will usually come out during your board exam. And these are after putting your antibiotic disc class, you incubate that one at 24 degrees Celsius and measure the zone of inhibition. So here, this is before, and this is resistant, and this is susceptible. So a measurement class of more than 14 mm indicates susceptible. So if you will see this one, more than 14 mm among measurement for the ZOI, then meaning the organism is Streptococcus pneumoniae. And aside from mucoidea, you need also to measure that one. If mucoidea, that will give you already an idea class that organism is Streptococcus pneumoniae. But there are organisms class that are non-mucoid. There are strain rather of Streptococcus pneumoniae that are non-mucoid but are alpha hemolytic. So you need to perform optokin test. So another test class is your Neufeld-Quellon's test. This is NEU class, NEU, Neufeld-Quellon's test, or capsular precipitation test. This is the most accurate and reliable specific method for the identification of your Streptococcus pneumoniae. It uses anti-pneumococcal antisera plus sputum and methylene blue. The sputum class, by the way, should be fresh sputum. Okay? Positive result, capsule refractile and swollen. So here is the picture of your Neufeld-Kellogg test. Okay, the blue there, it's color blue because of the methylene blue, and there you see swollen capsules. Another test class is your bile solubility. Bile solubility is considered as confirmatory test. Positive bile or absence of turbidity. Differentiate. These tests also differentiate from virulent streptococci. The reagent usually is sodium disoxalate or your bile salts. When turbid, the cloudiness of the broth clear after 3 hours of incubation. So your organisms class, particularly your Streptococcus pneumoniae, has the ability to lyse the presence of the bile. So here, this is your Streptococcus mitis, and this is your Streptococcus pneumoniae. It lyses the bile. So your Streptococcus pneumoniae class undergo autolysis with a surface active agent. That's why it's clear. Okay, this test here, mouse virulence test, this is done before class, but this is not done routinely done nowadays because it uses live animals. So this is done by putting pneumococci to the susceptible animal, okay, and observe if that particular animal died. So here, so the virulent bacteria, we extract virulent bacteria class or pneumococci from sputum and ibutang nimo siya sa mouse. If the mouse dies, then probably that is pneumonia. But if there is the mouse still live after the injection, after the intraperitoneal injection, then it's not pneumonia. So other miscellaneous tests include your Franciscan test, used to detect the presence of antibodies against Streptococci class. So your Franciscan test is an example of delayed hypersensitivity tests, particularly your type 4 hypersensitivity reaction. So review ng immuno. What are those delayed hypersensitivity reactions? Also, you have your coagglutination test, which uses particle-bound antibody to enhance visibility of agglutination reaction between antigen and antibody testing. We also have another test class. We have Dick's test. D-I-C-K test. Okay? The Dick's test class is also a skin test used to diagnose scarlet fever caused by your group A strep. Diba? Your scarlet fever is caused by your group A strep or your gas. So take note of this one. May come out during your board exam. Dick's test is also a skin test used to diagnose scarlet fever caused by gas. What are the treatment of choice for Streptococcus pneumoniae? You have there penicillin, ceftriaxone and cefotaxime, trimethoprim, sulfamethoxazole, and some quinolones like levofloxacin, moxifloxacin, and gemofloxacin. So please do study, by the way, and do not forget the mechanism of action. So another organism under genus Streptococci class is your genus Enterococci. Again, your Enterococci are grouped. You have your group D Enterococci and group D non-Enterococci. So your group D Enterococci, they are found normally in the large intestine of the human. So you have three most common pathogenic organism under group D Enterococci. You have Enterococcus fecalis, faecium, and gerans. While your non-Enterococci, these are commonly isolated in animals, occasionally in human. So the most common pathogenic organism associated to human infection is your Streptococcus bovis and equinus. So these are tested with these following biochemical tests. So we'll discuss that on the next succeeding slide. So this is an example of your bile isculin test. Okay, so your bile isculin test positive are your Enterococcus species. This one here is your 6.5 NaCl growth. Positive results is turbidity. Negative results is non-turbid. So Enterococcus are 6.5% NaCl will grow on 6.5 NaCl, while your Streptococcus will not grow on NaCl. Your Enterococci, again, are grouped into two. Group D specific substances. The habitat of your Enterococci, you have their human, animals, and birds. Enterococcus faecalis and Enterococcus faecium are normal flora of the human GIT and female urinary tract. So they gain transmission class via sterile sites. They also be transferred by a person-to-person contact or even contaminated medical equipments. The characteristics of your Enterococci, these are ovoid shape, pair or short chain arrangement. It can be non-hemolytic or sometimes alpha-hemolytic on blood agar plate. Can withstand above 80 degrees Celsius. They are bile isculin positive. So positive for bile isculin again is black pigment colonies. They are catalase negative and PYR positive. An example of your Enterococcus under gram stain. This is light microscopy or phase contrast microscopy. Okay, so as I said kanina, Enterococcus faecium and Enterococcus faecalis are the two most common human pathogen under Enterococcus. So how do we differentiate them? We differentiate them class using sugar fermentation. Okay, so you have there arabinose, sucrose, trehalose, hydrolysate arginine. These are not sugars anymore. So, ito lang yung mga sugar fermentation natin. So, how do we differentiate them? Enterococcus faecalis class does not ferment arabinose sugar. If ever the organisms ferment all the three sugars, you think of Enterococcus faecium. Okay? Again, in order to differentiate the two, Enterococcus faecalis does not ferment arabinose, while Enterococcus faecium ferment arabinose. All Enterococcus grow on 6.5% NaCl and hydrolyzed bile isculin. So for Enterococcus, these are usually associated with mixed infection of the abdomen pelvis, endocarditis, bacteremia, and these are usually nosocomial class type of infection. So treatment of choice, you have their penicillin, ampicillin, and vancomycin. Remember, you have organism, Enterococcus organism that are vancomycin resistant. So you can give other antibiotics for that, like aminoglycosides. Your Enterococcus organism also causes endocarditis class. Same with your Staphylococcus infection. So, other hemolytic streptococci, or the viridans group, you have different species. You have salivarius, mitis, mutans, and sanguis. Again, S. mitis, by the way, is can cause subacute bacterial endocarditis, while mutants can cause dental plagues, dental caries. Okay. What are these alpha hemolytic streptococci or viridans group? They lack group-specific carbohydrates, so they cannot be grouped as Landsfield system. The same with Streptococcus pneumoniae. Okay? They may produce green pigment when grown on blood agar media. So the green pigment there is your alpha hemolysis. They are normal flora of the mouth, pharynx, GI tract, genital tract, and even urinary tract. It can cause dental caries and dental plaques. If enter in the blood, it can cause meningitis and subacute bacterial endocarditis. Okay, so for alpha hemolytic streptococci, particularly the viridans group, they are still gram-positive cocci in pairs or short chain. They grow well on enriched media and requires incubation CO2 for growth, and they are alpha hemolytic. Since they are alpha hemolytic class, they are the same with your Streptococcus pneumoniae. Remember, viridans group class always yield resistant results to your optokin test. Okay? If ever sensitive, go for Streptococcus pneumoniae. But if it's resistant, you can always rule in the viridans group. So let's discuss in general, the laboratory diagnosis of your Streptococcus. Okay? You can grow them using chocolate agar plate, and the preferred medium is your blood agar plate. The first choice is sheep's blood, while the second choice is horse blood. Okay? Rabbit blood is the third choice because of it has poor type of hemolysis, and never use human blood. But in the Philippines class, since not all laboratories can afford these three animals' blood, we usually opted to human blood. Okay? But if we use human blood class, again, always use the EDTA or withdraw a fresh blood. Here, I want you to read this algorithm on how to identify, how to distinguish individual organisms under the genus Streptococcus. So similar, this is your alpha hemolytic Streptococcus pneumoniae, and viridans group. So these are presumptive identification of Streptococcus and Enterococcus table. So please familiarize. You do not need to memorize class everything. Just look at the salient results. Okay? Yung mga positive reactions. So readings, you read about group C and group G Streptococci and more of nutritionally variant Streptococci. So these are the references I use for this discussion. So again, if you have any questions, do not hesitate to email me on my PHINMA Ed email account or on my Rad Learning Facebook account. So thank you so much for listening. So before I end, I want to leave you this quote: never give up on a dream just because of the time it will take to accomplish it. The time will pass anyway. So good luck, future RMTs. Kaya nyo yan. Bye-bye.